Melanin is a beautiful thing. It protects us from sun damage, and it can help us to have a more delayed aging process. However, melanin can also be problematic when it is involved with inflammation or heat, because that pigment can be very unpredictable. And if you have procedures that are not necessarily intended, you can have consequences that are not desired. Seeking someone who has that knowledge is of the utmost importance, not only to help to avoid having a bad outcome, but also just to understand the cultural piece that really goes along with skin of color.
We love our melanin, that makes our skin brown, and we take pride in that. But also that same melanin structure in the skin can really determine what is safe for us to do aesthetically and what is not safe. It is of great importance that patients of color choosing to do elective aesthetic procedures see a board-certified dermatologist who has an interest and a special expertise in treating patients with skin of color.
I'm really happy that patients with melanin-rich skin are exploring these procedures and are interested in all of the new innovations that can help them to look their best at all times. However, a lot of these devices weren't necessarily studied for, intended for, or well thought out for patients with dark skin.
There are many, many options that are safe and effective. However, we have to recognize that there are nuances to the approach in using lasers, chemical peels, microneedling, and many other procedures in skin of color. Because of increased melanin and other characteristics, there can be complications such as hyperpigmentation, loss of pigmentation called hypopigmentation, and even scarring if an inappropriate device or technique is used in the context of melanin-rich skin. So when it comes to treating patients with skin of color, we really customize the device that we're using, the parameters that we're using for that patient's skin type.
For example, within the world of lasers in particular, there's a lot of lasers that can be done safely in skin of color, but one such laser called intense pulse light, or sometimes broadband light, is one that I would never do in a person with darker skin because it could potentially result in burns and hyper or hypopigmentation.
As dermatologists, we worry about when patients take matters into their own hand, if they start treating themselves with a variety of over-the-counter procedures that sometimes you can do at home, or if they seek the care of a non-professional skincare expert who doesn't have the training and is not able to manage the complications of these complicated procedures.
You have to be really careful, especially with the laxity of the laws and regulations in certain states allowing less trained professionals to perform these procedures without the basic knowledge of skin anatomy, knowledge of the devices and the wavelengths of the particular lasers. We've seen some really bad outcomes. All of these things could be avoided with proper education.
I want patients to know that aesthetic procedures can be safely and effectively completed in patients with darker skin types. With advances in technology, we're able to safely do these procedures. It still is important to seek the care of someone who has expertise in this area and knows the potential risks involved when undergoing these procedures.